have to give a priority to the patient who is more needy and suffering from really a grave situation. So we have to see that patient at a quick manner and in a very, very brief introduction, like a capsule type of history we have to take. So we have already discussed on this point. So there is no need, I think so. We will come across again. So we have already discussed the triage means to sort, and the golden hours is very, very important. So the rule, few lines I have added in this slide because I have added from just gone through some of the paper also and Merck's manual. So some of the lines are added. So you see the rule of emergency is to treat the most life-threatening problem first. So being a clinician, if you are looking at a large number of cases, your role is to look for the patient first that is suffering from a life-threatening problems. And what will be the life-threatening problem? We will come across in the next slide. So we have already seen the ATT, that is just like a human being. We have to establish animal trauma triage scoring system. And on the basis of this scoring system, we will try to judge what type of emergency is, whether the animal is suffering from cardiovascular or respiratory or neurological or any type of trauma. So different system is there. There are 6 systems is there. On the basis of that, the primary survey, on the basis of the primary survey, we decide that this animal needs such type of treatment. Now the secondary survey come the APPLE, that is acute patient physiological laboratory evaluation score, in which we collect some of the sample like the blood sample, we go for the ECG, we go for the ultrasonography, then we can judge the real problem. So first we have to stabilize the patient on the basis of ATT, and then we have to take a sign from the owner that your patient is very, very critical, and we are trying our best to recoup the patient. So APPLE score requires a blood result, so it cannot be done immediately. It should be done after the stabilization of the patient. So this ATT score we have already discussed, the perfusion, the cardiac, we will come across the cardiac, the respiratory system, the different eye, muscle, and integumentary system function, the skeletal and the neurological disorder. It includes the six parameters. So triage system should be designed to identify which patient required first help and help guide the prognosis. So it should be rapid, reliable, and not cumbersome. It means you don't have to devote too much time on diagnosis. Just by viewing certain parameters, I will come across, just by viewing few parameters, whether the animal is in shock, whether the animal is bitten by a snake, whether the animal has suffered from a trauma in the head injury or the chest injury, or whether the animal is apneic, means whether the animal is suffering from respiratory distress, is not able to respire, or whether the animal is suffering in cardiopulmonary state. So the best row, most of the common problem is CPA, cardiopulmonary arrest is the main time when the owner bring the dog to you, and the problem like some of the other emergency we will come across. So for that, we have to decide some area. There should be a specific area. Otherwise, if an emergency patient come, we run here and there for search of some tube, for the search of thermometer, for the search of stethoscope, for the search of oxygen cylinder. So there should be a specific area, emergency area determined, as in human hospital. They have a separate opening for that. And most of the important medicine, like the medicine like atropine sulfate, the adrenaline, the prednisolone, the other corticosteroid, dexamethasone, some of the antidote for certain common poisoning condition, they should be kept at that place, and so that you can give immediately to the patient. And the printed table of doses, because this is the most important point, because these medicine are not used very frequently, and we sometimes take some time to decide the dose. So that time gap is very, very important, and we may lose the golden hours. For that, we should have a printed table of all the important medicine that you might have seen. We have kept one chart in your CCU unit. In that way, you should have in your bag also a printed table and laminated table, so that it can be used for a very, very long time, because emergency patient is very, very rare. Out of 100 patients when you will see in your life, you will get only 5 to 6 emergency patients, and that is the main idea of a doctor to save that emergency patient. So you should have a printed table of doses to reduce the mistakes in the doses. So the two type of survey we have to decide. The first, the immediate, is the primary survey, and then we go for the secondary survey, what was the main problem. So the primary survey is generally designed for cardiovascular, respiratory, neurological, and then you have to act immediately. So the mnemonic is this, you just remember it by a term ABCD. We have already discussed. A for alert, whether the patient that comes to you is alert or unconscious or comatose or in a stupor, whether the animal is breathing or not, whether the respiration is going or not. Just you see by seeing the chest movement, you can determine, or by putting your palm just near the nose, you can see whether the animal is breathing or not. And then whether the circulation is by visualization, by palpating the pulse, whether the animal is showing the circulatory movement or not, or whether there is any disability like any type of accidental cases. So this ABCD will decide the type of grave situation, whether it is a neurological problem, whether the animal is suffering from cardiopulmonary arrest, or whether the animal is in shock or in a hypovolemic shock. So how you will do judge? There are so many numerous instruments are there, but initially, being a clinician, if a patient is brought to you in a clinic in a very, very rush manner, the owner will come, or they may phone you just on a telephonically call that I am doctor, I am coming and my dog is showing like a seizure. It may be in hyperdynamic stage or it may be in a shock stage. Then you have to immediately examine the patient, and by touching few of the things, you don't have to go for a large number of investigation. Just chest excursion you have to see, because we are doing ABCD or ABCD, in which the A for alertness and B for breathing. Just you see the movement of the chest. You just see the movement just by visualization of the patient on the stretcher. Just by a chest excursion, you can visualize whether that this is little bit movement is going on or not. Then you have to touch the cornea. Just touch the cornea, whether there is any reflex in the cornea or not, or by touching the eyelid. Just you touch the eyelid or that just the cornea, because when the patient comes to you, sometimes there may be some respiration, but the eye is just like a fixed like this. It will not show any movement. It's just like a fixed eye. Okay, so this is the criteria for the initial. Within 5 to 10 seconds, you can judge chest excursion by touching the cornea and by eyelid touch. If there is any movement, or if there is not any movement in the cornea or both, it is a reflection that the animal has entered into a cardiopulmonary arrest. So this is one of the earliest criteria for the judgment of the patient. Okay, then other primary survey. Yes. Hello. Okay. Are you hearing? Are you hearing me? Hello. Hello.
Yes sir. Yes sir.
आवाज आ रहा है? अजीत आवाज आ रहा है? Hello.
Yes sir. Yes sir. Yes sir. Yes sir.
Okay. बहुत लंबा है. हमें पहले एक बार इसको बोल देने दो. Otherwise my link will break. Okay. But this is not only emergency condition. There are so many emergency conditions. We should be prepared for that. And I am just enumerating it because it is beyond the scope of this chapter that we will deal with each of them. So one of them is suspected trauma. You see in the surgery, the different type of accidental cases are coming, and the cases of a small animal falling from the floor, first floor, second and third floor. You might have, some of you might have seen that my dog has just fallen from first floor in second floor. There is no injury, there is no outside injury you see. Okay, कोई फ्रैक्चर नहीं मिलता है. आप एक्सरे में जाते हैं immediately, तो वहां पे आप देखते हैं कि कुछ नहीं मिलता है. And after some days, 1 and 2 days, the animal collapse. ऐसा क्या होता है कि बाहर से कुछ नहीं दिखाई पड़ता है, कोई जानवर ऊपर से गिर गया और एक्सीडेंट हो गया, फ्रैक्चर हो गया, वो तो अलग बात है. But trauma to the patient, especially at the vital organ, is very, very important to judge. And this can be judged immediately by seeing the various parameters. Then we have already gone through a chapter of poisoning. There are so many poisoning conditions. the important poisoning condition we see in large and a small animal. A small animal then you suffer from different types of pains, different types of baits you put for the rats. Rat poisoning condition is there. So you have to keep some of the antidote for important poisoning condition. And in this condition, when there is large number of lush green grasses are there, there are chances of toxicity of cyanide, hydrogen HCN poisoning condition. When sorghum and other grasses, the owner used to feed their cattle, so they used to suffer from this types of poisoning. Then profuse vomition and diarrhea. That is a critical condition. When the animal suffered, some of the owner will complain that my animal has does suffer from 20 times vomited, or suffering from a continuous diarrhea. Then there is a condition of hypovolemic shock arises. So this is again a grave situation. It looks very simple, that animal is vomiting, that animal is in diarrhea, and it is not in a critical condition. They are in a critical condition because of the loss of the electrolytes. Then the biggest problem in all of you might have seen the urethral obstruction. How many of you have seen the urethral obstruction? This is a really a very, very important urethral condition, especially in our hospital also. How many of you have seen the urethral obstruction or the retention of urine? People come to you, and आप लोगों ने देखा है ना, urethral obstruction या retention of urine. This is really इमरजेंसी कंडीशन जो आपके साथ आ सकता है, और इसीलिए आपको तैयार होना होगा। सिर्फ सीपीए के लिए तैयार नहीं होना है, इसके साथ ये सारे इमरजेंसी कंडीशन है। अगर एक यूरेथ्रल ऑब्स्ट्रक्शन या मेल या फीमेल है, अगर एक रिटेंशन ऑफ यूरिन आपके पास आया है, यू जज इट इज ए केस ऑफ रिटेंशन ऑफ यूरिन ऑन कंप्लेन दैट द
बारिश हो रहा है ना,
लिंक टूट रहा है।
आगे
ओके ठीक है। हेलो, ओके अजीत, आवाज आ रही है?
यस सर।
ठीक है। तो अभी हम लोग देख रहे थे यूरेथ्रल ऑब्स्ट्रक्शन। अगर आपके पास उस तरह का कैथेटर नहीं होगा तो आप उसको कुछ नहीं कर पाएंगे। आपके पास पहले से लुब्रिकेंट जेली होना चाहिए, कैथेटर होना चाहिए, लोकल एनेस्थेटिक होना चाहिए। अगर ये 2-3 चीज आपके पास नहीं होंगे तो हाइड्रोप्रोपल्सन टेक्निक करके आप उसको रिट्रीव नहीं कर सकते हैं, या फिर आपको एब्डोमिनोसेंटेसिस सिस्टोसेंटेसिस करके यूरिन निकालने का आपके पास उस तरह का सिरिंज या निडल आपके पास होना चाहिए। Then labored breathing, this is again a very very important problem, and cardiopulmonary सबसे ज्यादा केसेस हम लोग लूज करते हैं अपने यहाँ लेबर्ड ब्रीदिंग से आए हुए केसेस का और सीपीए का, कार्डियोपल्मोनरी अरेस्ट का, क्योंकि ये सबसे लास्ट टाइम में आता है। एंड द एनिमल्स आर ब्रीदिंग and open mouth breathing, they might be in the cyanotic condition, and at the last when it comes and immediately die on the table because a simple postural change। ऐसे एनिमल में अगर वो उस तरह से सफर करते रहते हैं तो ऑर्थोपेनिक स्टांस में होते हैं। अगर सिंपल हम पोस्चरल चेंज या टेबल के जाने पे बाद भी एनिमल कोलैप्स कर जाता है। अभी इसके बारे में हम बात करेंगे कि कौन कौन से टेक्निक से इसे हम 50% केसेस को लगभग बचा सकते हैं। दूसरा सबसे बड़ा प्रॉब्लम, द मोस्ट इंपॉर्टेंट प्रॉब्लम इन आवर हॉस्पिटल आल्सो, एंड व्हेनेवर यू आर गेटिंग ए सीवियर केस।
नहीं दिख रहा है, स्लाइड नहीं दिख रहा है।
स्लाइड शेयर नहीं है? ओके
नहीं सर,
ठीक है, देख लो। आया? हेलो हेलो?
यस सर, आया सर।
Okay. So the another biggest problem is seizure. Seizure patient generally is brought in the hospital and they are in a very very grave situation. Most of them are in a jumping stage, they are frothing stage, and the owner feel very angry. If you are not able to control the seizure within few minutes, the animal feel that you are doing nothing. But this seizure is one of the situation in which you will see that animal is suffering from a different type of a stress, showing a jerky movement. There may be frothing from the nose, mouth. So it looks very, very dangerous condition. So seizure is one of the problem. Then loss of consciousness is there. Excessive bleeding. Again, this is a very, a situation in which you will find that generally in case of summer season, we will find a bleeding from the nose. Epistaxis is one of the problem in which it is very, very difficult to control immediately. Most of the time, the owner bring it as an emergency condition. Then other, in case of gynecology, another problem, the prolapsed organ problem is there. There may be a snake bite condition and few of the cases of GDV. How many of you have seen this case? We have already seen 3 to 4 cases of GDV in our hospital. Gastroduodenal volvulus, GDV, just a large abdomen, okay? So animal will come to you in a very, very distressful condition and you will find the distended abdomen. Now, first you have, within a few seconds and few minutes, you have to take a, if you have a facility, first you go for the palpation and you have to judge whether this is a case of ascites or whether it is a case of GDV. Within a minute, we can determine that it is a case of GDV, and in that condition, you have to rupture the stomach and you have to remove the gas immediately. Otherwise, it is very, very difficult to treat such type of cases in emergency condition, or you have to pass an endotracheal tube into it and you have to remove the fluids and the gases from this region. Again, the other problem may be burn, dystocia, and the shock are the other emergency conditions. So coming to the cardiovascular system, we have already gone through the cardiovascular system. So there's no need of I am just enumerating here as an emergency condition. We have to determine the rate, the quality, and the synchronicity, means pulse deficit you have to see. The blood pressure is very, very important. So this is one of the criteria of the judgment of whether the animal is suffering from some congestive heart failure or peripheral. So this is 80 millimeter Hg. So if this is the main marker of the severity, so marker of severity judged by absence of peripheral pulse. So if you are judging the pulse and if you are not able to find the pulse, it is suggestive that the animal is certainly suffering from low blood pressure. So that is it's one of the indication without measuring the blood pressure. So if you are not getting the pulse in the animal, it suggests that they are certainly suffering from a low blood pressure. And then the color of the mucous membrane is again very important. The color of the mucous membrane and the capillary refill time. We have already discussed about the capillary refill time. You have to invert the lip. You have to press on the gum, and then you have to see the see the timing. If your timing is more than 2 seconds, it's suggestive that there is a perfusion problem there and heart is not pumping properly. And then you have to go for the auscultation. We have already discussed in the then. So all these are the suggestive of the CPA, cardiopulmonary arrest. Next, the respiration. We know the respiration is again a very important criteria. The animal will show open mouth breathing. There will be extending the neck. The neck will be in a just extended manner. The stance will be orthopenic, that is abducted elbow is there. And the animal sometimes unable to adopt the comfortable posture. The owner will complain that my animal is not sitting properly because it will put pressure during sitting process. The animal feel pressure in this chest region, so they are unable to sit comfortably. Okay, then the respiratory noises. The two respiratory noises, the stridor and stertor. Actually, these noises are from the upper part of this region of the respiratory tract, and due to that, just जैसे आप snoring करते हैं, that is stridor, and stridor is just the passage of the air from a lumen that is compressed and that is filled of fluid. Will show some of the sound without auscultation. You can hear from distance that some noises is coming out from this respiratory tract. And then when you go for the auscultation, you can find wheezes and crackles, the two very important sound. The wheezes and crackles you have to differentiate. Wheezes is formed from the smaller tract of the respiratory, for example, the bronchioles and the bronchi, and it is generally found during the expiration. Okay, just you have to see whether the sound is coming during expiration or whether the sound is coming during inspiration. So generally, wheezes determine the bronchitis problems, the smaller airway problem. There may be shortening of the lumen, or there may be fluid accumulation in that region Therefore, you will find a wheezes-like sound, and crackling is the sound of the alveoli. So this is the real lower tract problem, especially the alveolar problem is there, and you will find a crackling just like a जो आप चटाई बम या दूर से किसी का आवाज सुनाई देते हैं, that type of crackling sound you will find, and this is an indication that animal might be suffering from pulmonary edema or severe pneumonia. So again, we can see for cardiopulmonary arrest. So again, the third one is the neurological, whether the animal is alert or not, whether the animal is dull, whether the animal is stupors. It means it is responding. Stupors is a condition just before the comatose condition, just a condition in which it is unaware of the surroundings. There is no, suppose an animal is standing, and if you throw, it will not show any type of resistance. And then the last stage is the comatose conditions. So these are some of the conditions. And then our comes the situations when we have to control that situation, and by the different triage method. So initial examination, we can do mentation, breathing, respiration, abnormal body limb posture. The vital sign we have already seen: heart rate, respiration rates, mucous membrane color, capillary fill time, and baseline data. We can, if we have a time from a secondary survey, we can go for ECG and the CBC for the, and then we can, at the last, you see, we have to see the history. We have to then collect, we have to history. When after doing this, then we collect the history. Then come the time of the shock. There are different type of shock condition, and we have to address the shock. Generally, if it is cardiopulmonary shock is there, the heart failure condition is there, the blood pump by heart is decreased. Then there is a chance of distributive shock. Generally, this is present mostly in the vasodilation condition, mostly found in the sepsis, in the anaphylaxis. Then the arterial resistance is, there's a loss of fluid in the interstitial space, and blood return to the heart is decreased, and there is decrease in the blood pressure. Then obstructive type of, then the physical obstruction in the circulatory system. And then the most common one we find in our condition is the blood loss or the dehydration that leads to hypovolemic shock. So there are different parameters for the judgment of shock. You just see the mucous membrane, and by respiration, color of the mucous membrane, respiration rate, breathing, auscultation, and cardiovascular by heart rate, the ECG, the color of the mucous membrane, the capillary refill time, and urine production. So some of the other parameters that we can judge the shock is by the oxygen saturation. These days we are talking about the oxygen saturation, and very simple machines are there. The pulse oximetry is there. On the basis of that, we try to determine the oxygen saturation in the blood. So that is, if it should be more than 90–95% oxygen saturation, and if it is going below, then we suspect we have to supply the oxygen. And then the measurement of the artery. So these are some of the instruments for the measurement of arterial blood pressure. Because the blood pressure we measure is not very accurate in animal, because the cuff is different. Although we have purchased, recently we have purchased a blood pressure machine for different animals, but that is not very accurate, because we have to see the arterial blood pressure, and for that we have to depend upon the color Doppler types of BP machine. So that is the most advanced type of machine for the measurement of arterial blood pressure. Then some of the laboratory data that can determine the hematocrit PCV value. It is increase in dehydration, it decrease in blood loss, and some of the electrolytes. You see the electrolyte, the most important thing in case of emergency is ABG. What is ABG? Can anyone?
Arterial blood gas.
Gas analysis. Okay. So
Yes,
whenever you go for some of the emergency patient, they will give you a chart immediately within 1 and 2 seconds. They collect blood from the arteries and they go for ABG. So this is a very important criteria for the judgment of oxygen, the CO2 level, especially the animal that is in shock condition. So we too have to keep ABG. Unfortunately, we don't have ABG. I am trying for the ABG machine in our critical care unit, because this will not only help me in determining the different type of shock condition, because sometimes the animal's CO2 level is increased in the brain and animal remains in a sleeping condition, and you will not be able to determine whether it is due to CO2 or due to loss of oxygen. So if the CO2 level is also increasing, you see the CO2 level is very, very important in determining, and that can only be determined with the help of ABG. And it also gives some of the electrolytes parameter, like the acidosis and alkalosis parameters, because generally in that condition, in a grape situation, the lactate level is greatly enhanced in the blood. So on that basis, we can calculate the different types of crystalloids and colloid types of fluid therapy. So if the animal is suffering from CPA, we have to do CPR, okay? And you see a doctor like me, okay? Can you laugh on me? Yeah, I am trying. So one पे come, जानवर मर जाता है कभी कभी. बहुत सारे अभी आप न्यूज़ पढ़ते होंगे कि वो उसका मर गया था, उसमें वेंटिलेटर लगा दिया और पैसा लेने के लिए, इस तरह ह्यूमन में कुछ सुनते हो अजीत इस तरह का बात? So this is the condition. सुनते हो ना? तो ये देखो ऐसा कर रहे हैं, बेचारा मर गया है. I admire your persistent doctor. कभी कभी हम लोग कोशिश करते रहते हैं और कभी कभी करना पड़ता है. Sometime अगर बहुत सारे कंडीशन ऐसे आते हैं हमारे यहाँ कि एक इस तरह से इतना एग्रेसिव होकर के 4-5 ऑनर आएगा, अपने गाड़ी को आपके पास लगाएगा, बोलेगा डॉक्टर देखिए मेरे डॉग को, और अगर आप नहीं देखते हैं और इमीडिएटली आप बोल देते हैं कि नहीं बचा है, तो समझ जाइए आप पे अटैक हो सकता है. ओके, सो यू हैव टू डू द प्रोसीजर. You should be persistent. You have to adopt the procedure. You have to examine the mucous membrane. You have to examine the heart. आपको पता है, you have seen its cornea, you have seen its palpebral reflex absent, okay? But you do some procedure for few minutes and then wait for some minutes and then said, okay, sorry, okay? So this will save you also when you will be alone in the field condition, or some of you will, when you open your own clinic, it will give you some time so that the animal owner should not go in shock. ओके जैसे ही वो सुनता है अरे मैंने इतना बड़ा अस्पताल में लाया और इन्होंने बचा नहीं पाया, but most of the time the animals are died before it comes to the clinics. So that should be kept in mind. This is not this is just a lesson from my experience that such type of situations should be handled with carefully. Okay, so there are so many causes of CPA. It may be anesthesia, trauma, heart disease, autoimmune malignancy, trauma and infectious disease. There's so many causes, and for that we have to go for CPR, and that resuscitation provide ventilation. You have to provide the artificial oxygen. You have to go for the chest compression. I will show you. You have to establish an intravenous line, and you have to give some drug also to stabilize and stimulate the cardiac losing cardiac function. And we have to monitor also some of the parameters. For that, we have to supply oxygen. There should be good lighting facility, and the cart and the medicines should be available there. So these are some of the list of the medicine. I'm not going in detail because just you go through. Okay, इसमें नहीं जा रहे हैं हम, आप देख लीजिएगा ये सारे मेडिसिन हैं जो important list है medicines का, और वहाँ पर भी लगा हुआ है. Now the most important things is the laryngoscope, endotracheal tube. You have to practice to put an endotracheal tube because this will help in maintaining the airway. ABC treatment मैंने बताया था, airway, breathing and circulation, तीन चीज को आपको establish करना है. अब air provide करना है. Choking को generally most of the animals remain in a choking condition, so you have to establish a airway line. Airway line can be established only if the animal is not breathing. You have to establish an endotracheal tube. Lubricant jelly. For this you have to practice. It doesn't mean एक बार एनिमल आपके पास आया, आपने इंडोट्रैकियल ट्यूब, उसके पहले आपको लेकर के 1-2 बार प्रैक्टिस करके इंडोट्रैकियल ट्यूब लगाने का प्रयास किया जाएगा. Okay, so these are some of the important. Then you have to go for oxygen therapy. There are various methods of oxygen therapy. You can go by this type of oxygen, where you by putting a mask on the mouth, by putting a tube in this region, or even if you want to give 100% oxygen, then you have to depend upon a positive pressure ventilator. So you can give ambu bag, or in an emergency condition, you close the lip, put your mouth on the nose of the animal, give 3 push. 3 बार आप breathe करिए animal के लिए, 3 बार आप breathe करिए, 3 से 5 बार आप breathe करिए, and give a chest compression. So there is a ratio of that. you have to give a humidified nasal oxygen at the rate of 50 to 60 ml per kg per minute, delivered 40 to 60% of inspired oxygen. हम लोग बोल देते हैं ऑक्सीजन लगा दो, किसी स्टाफ को बोल देते हैं. कभी आपने सोचा होगा कि कितना ऑक्सीजन देना चाहिए? हम लोग ह्यूमन बीइंग तो है नहीं, वो एनिमल ह्यूमन बीइंग तो है नहीं जिसका वेट 50 या 60 केजी के आसपास या 70 केजी के आसपास में वैरी करते रहेगा. कैसा ग्रेव सिचुएशन है, आपने SpO2 से क्या मेजर किया है, ऑक्सीजन का सैचुरेशन क्या चल रहा है, आप यहाँ पे कैलकुलेट करके देख लीजिएगा. एक 5 केजी का कुत्ता है, अगर वो रिस्पायर नहीं कर रहा है, एनोक्सिया में जा रहा है, उसको ऑक्सीजन देना है तो क्या रेट होना चाहिए? जस्ट यू कैलकुलेट ए 10 केजी डॉग by 50 ml per kg. Okay, a 10 kg means 500, आधा लीटर चाहिए प्रति मिनट. Now when you will come after this lockdown, you just see the knob. जो ऑक्सीजन सिलेंडर लगा है उसमें आप देखिएगा एक नॉब लगा रहेगा, उसमें रेट लिखा रहता है 0.25, 0.5, 1 लीटर, 2 लीटर, 3 लीटर, 4 लीटर, 5 लीटर, 6 लीटर, 7 लीटर, इस तरह से लिखा रहता है. ब्लाइंडली हम लोग बोल देते हैं कि इसको ऑक्सीजन लगाना है. Just you see, at least approximate weight should be calculated. Whether this dog is Labrador, whether this dog is Great Dane. अगर एक Great Dane dog है, अगर वो 70 किलो का है, we have to multiply this by 70 kg, and then on that basis we have to open the knob so that it will give the sufficient amount of oxygen. However, if the animal is serious, we have to put a nasotracheal catheter or bilateral nasal cannula, or the last step is ventilator that will provide 100% oxygen to if the animal is not recovering from this oxygen therapy. आपने देखा होगा इमरजेंसी पेशेंट को वेंटिलेटर से उतरने के बाद उसको कुछ दिन तक ऑक्सीजन पे रखना पड़ता है और बीच बीच में ऑक्सीजन बंद करके देखना पड़ता है कि साइनोसिस तो डेवलप नहीं कर रहा है, मतलब वो खुद से रेस्पिरेशन कर रहा है या नहीं कर रहा है. So these are some of the method of chest compression. The ratios is very, very important. And breathing is very, very important. You have to give a 30 chest CPR, and then you have to 2 type, you have to ventilate. So 30:2 ratio is important for recovering of the patient. And this is one of the biggest thing in Hemi-Lynch maneuver. आपने सुना होगा घर में बच्चे होते हैं, हॉस्पिटल में डिलीवरी होता है, देखे होंगे डॉक्टर ने बड़ा निर्दयी रूप से उसको जन्म लेने के बाद CS करने के बाद उलट देता है और बताता है कि ये तो सांस नहीं ले रहा था, और